Whether you live in the chaos of a busy city or isolated in the middle of nowhere, there are bound to be social problems. This video will analyze and compare two areas, urban and rural. We will take a closer look at three categories. The first thing we'll look at is crime.
A major social problem affecting urban and rural populations is crime. While they differ in the type of crime that is committed, the people and environment interact to create very unique situations. We are going to relate these crimes to symbolic interactionism and how that affects decisions.
Urban crimes usually consist of violent crime and property crime. As the graph shows, crime rates in big cities are 3 times higher than the same crimes in rural counties. Some believe this is due to high poverty levels in cities, but actually that's false, as poverty levels in rural counties are higher. Instead, this could be explained by residential crowding and household crowding. Residential crowding is higher population density in cities, whereas household crowding is too many people in a very small space all living together.
Rural crimes are much less focused on property and instead focuses on family and neighbors. Specifically, domestic violence crimes are the largest form of delinquency that rural areas suffer from. Since there is a lower amount of people in a much bigger space, crime is centered in the home. This graph from PubMed exemplifies this problem. It shows that a lack of availability of resources in domestic violence shelters is much more common in rural areas than in urban areas. Rural populations may have to drive up to 60 miles to receive the help they may need, which is oftentimes not possible. Another cause of this is small communities are more centered on not causing problems within the group. Many people ignore domestic violence claims because they are in favor of peace within the community.
Becca Glover from A Family Place informed us more about domestic violence in rural areas.
I think rural communities have a lot less because you just don't think that you'll need them in such a smaller community. We see that a lot in Smithfield and in Hiram. They are smaller communities. They're kind of outside of Logan, but we do have a family place center in Smithfield and in Hiram. Where I think the fear of leaving something you think is right or that you think you love that person, the fear of what happens if I leave and I don't know what to do and I don't know where to go or who to turn to, which is why we're here as the family place. That's why we have organizations like us and CAPSA and so many other organizations that are here to offer those services and those that help.
Symbolic interactionism can explain this prevalent problem through traditional gender roles. In rural areas, the males are still seen as being the powerful breadwinners, and the women are supposed to be submissive and homemakers. The traditional gender roles are learned through the interactions within the community and immediate family. While crime is an issue everywhere, the type of crime differs depending on where and how you live. City dwellers are more likely to suffer from violent and property crimes, whereas rural populations deal with much higher rates of domestic violence.
A solution to urban area crimes is creating a program where young adults and kids can go and it's a safe environment where they can have some privacy and stretch their arms. A solution for rural area crimes is to create some programs that are closer to the rural areas so people have the availability to go and get the resources they need.
The next area we will explore is education.
There's actually quite a bit of differences between the urban and the rural school districts. They actually found in all but 6 states that there's a big disparity between the amount of funding that goes towards urban school districts compared to rural. And specific examples such as Michigan, Connecticut, and Massachusetts, there were some big issues in the fact that they were getting over 50% more funding for those school districts. As well, the 6 states that they found it didn't correlate to, such as North Dakota, South Dakota, to Kentucky, they also found that those are more rural states in general, so that's why they could be focusing more on the rural standings of those points to increase rural funding due to the fact that that is more what those states are focusing on.
A study done back in 2014 compared urban and rural school districts in New York City in the United States. In that study, it took math scores as well as ELA scores and compared the students on how well they progressed. The interesting fact about this is in the rural school districts, they got pretty much the same test scores as the urban school districts. However, due to the population and the size of the classrooms as well as the school districts, the urban school districts receive more funds from the government and were able to spend more on each student compared to the rural school districts.
They actually come from Title I funding that's done by the government, and they're based off property taxes. So because they're based off of property taxes, there's a large disparity between rural and urban settings, and it affects the per pupil expenditures in each of those settings. So in a rural community where there's not going to be as many people living together, it's going to have less property taxes, and they're not going to have enough money to fund their education programs, rather than an urban setting where there's going to be less poverty and combined rates of higher property taxes. They're going to have a lot more money to put towards their education.
Tammy Nelson, a teacher and administrator for 20 years, talks about funding in rural communities and urban.
I think funding it's a really it influences everything that you will do within your district. And so if you have funding, you will see a lot of up and coming programs being implemented. You will see technology being a part of the classroom, whereas and iPads for the students and all of those different resources can really have a big effect on the students' ability to learn and to be able to master the standards they've been asked to master.
In regards to conflict theory, we've noticed throughout our interviews that there is a slight difference between the rural school districts as well as the urban school districts in the education formula, I guess. An example right here of something that happens is that due to the population size of the classroom, the amount of money given to that school district goes up. This doesn't allow the rural school districts that might get the same test scores as the urban school districts to get those same resources that somebody with a higher population might receive. This is a conflict in our education system.
In regards to the urban and rural school settings, the per pupil expenditures are actually far less in a rural setting. So those rural students are not getting the same amount, even though they might be hitting the same amount of test scores. And so because of that, they're not getting the best education they can, and they don't have as many resources, extracurricular activities, and curricular activities in school. So teachers in rural settings are going to be a lot more difficult to find, and that's why you have a lot of new teachers that are graduating back with bachelor's degrees who go towards rural settings. Basically, they can't pay them enough, so they're far below the national average of what teachers are paid. In regards to a solution for the conflict theory between rural and urban school districts, which we have explained by showing our graphs, basically, Title I funding needs to be adjusted due to the fact that an All Children Equal Act has already been passed. There's $14.5 billion that is distributed annually to different school districts, and that needs to be more equally distributed because of the fact that it needs to be taken off of property taxes and more distributed based on education, and each per pupil expenditure needs to be equalized.
Also, another thing that we can do to help this conflict is to fund school districts based on their achievements and not necessarily by their population size, because like we have stated before, due to the population size of rural school districts compared to urban, they're not allowed to receive the same type of education as well as extracurricular activities that most students do achieve here in this country.
Lastly, we will discuss health.
From physical to mental health and even the kind of health care received, both urban and rural populations experience different social problems. From a functionalist viewpoint, good health of a population, great health care providers, and orderly medical facilities are necessary for a society to function effectively. Patients must be willing to adhere to their doctor's advice to improve their health. This can be difficult when outside factors that exist in urban and rural areas prevent this ideal, high-functioning society which functionalism strives for.
The busy, chaotic lifestyle lived in the city can cause physical harm to those who live there. For example, air pollution created by heavy traffic can cause people to suffer from asthma, respiratory, and heart disease, and can even increase the mortality rate. These health conditions become a long-term struggle for those who live in the city.
Within urban cities, we see an increase in homelessness. People who are homeless are exposed to harsh weather and terrible living conditions. The homeless are up to 20 times more likely to suffer from chronic illnesses such as hepatitis, high blood pressure, tuberculosis, and vascular disease.
While there may not be air pollution in rural areas, there are a huge lack of doctors, hospitals, and other medical clinics. The National Rural Health Association points out that although 1/4 of the U.S. population is rural, only 1/10 of physicians practice in rural areas. Urban areas have 134 physician specialists for every 100,000 residents, but rural areas have less than 1/3 this number. Even in emergencies, medical attention cannot be provided quickly or efficiently to those who live in rural areas, which increases the chances of death. The long distances from rural areas to medical facilities make travel slower and less convenient. Those in rural areas are less likely to seek out medical attention because of the long distances.
Maddie, our classmate, has had her own experience with the problems of healthcare in rural populations.
At the age of 5, I was diagnosed with type 1 diabetes. I go see an endocrinologist and I have to travel about 2 hours to go see him. He's in Salt Lake City. Well, for the longest time, I didn't even go to an endocrinologist. I just went to my family doctor who just took my A1C and told me what that was, and that was basically it. He didn't give me any help. He didn't tell me what I needed to fix, and I mean, it's been 6 years now, and I can already see negative effects towards my feet. I'm at the early stages of neuropathy, and I'm only 19 years old, and there's problems with my kidneys and my eyesight, and so not wanting to go, travel that far to go see an endocrinologist has really been really bad for my health.
Dr. Blotter, a local ENT, has found a solution to help those in rural areas.
Ear, nose, and throat care is a subspecialty surgical care, so there is not an ear, nose, and throat doctor in Tremonton, and so about 6 years ago I started a clinic, actually when they were having road construction that made it very difficult for people to come over to Logan. And I've been going there every other Tuesday since that time. It's worked out really well. The people really appreciate it. There are some people, especially older people, who come see me who would have a difficult time coming to Logan or finding an office in either Logan or Tremonton. It's harder for them to get care. Oftentimes there's fewer doctors, and if they require specialty care, that can mean, more complicated big trips for them to either Salt Lake or other places.
Now we must consider mental health in urban and rural areas. Urban areas still have mental problems, but because they are in a bigger area, it is easier to get the medical attention. Still, with such a high population, it can be competitive to find a doctor that can actually fit you into their schedule. Rural areas are more likely to not have adequate mental health care and drug abuse counseling.
As for solutions, in urban areas, there is already technology that exists that can improve the health and air quality, such as cars that are made to be fuel efficient, and even electric cars that emit no air pollution at all. But due to social lag, we have not yet made this change to cleaner technology. And while homeless shelters exist, there's not enough to support the homeless population. An increase in shelters, food pantries, and other programs would help to improve the health in these cities. As for rural areas, just as Dr. Blotter mentioned, there are options for doctors to travel to rural areas to help the people that live there. More facilities and healthcare providers need to take this opportunity to help those in rural areas.
Something that is becoming more common in the medical field is online patient portals. You can go to the website that the doctor has and log on to the portal with a username and a password. On your portal, it has medical history, all the medications you have, and an option to email your doctor with any questions you may have, and they can get back to you within 24 hours. Whether you live in an urban or rural area, health problems within the system exist. But as we bring attention to these health problems, we can achieve the ideal functionalist view of an effective, healthy society.
Thanks for learning with us about crime, education, and health in urban and in rural populations.